Hello everyone, Dr. Isha this side, your TTC companion from Be Healthy with Dr. Isha. Today we have Dr. Kalyani with us from Nova IVF Indore. She's a clinical director with Nova IVF, and we are having this discussion around IVF and IVF failures. So before I start, I would like Dr. Kalyani to introduce herself and also speak a bit about her center.
Hello, all Insta fam and anyone who is watching us today. I am Dr. Kalyani Srimali. I am an infertility specialist and an IVF specialist. I have specialized in this field after completing my MS Gynaec, and it's been more than 17 years that I've been practicing IVF, and I've done almost more than 6,000 procedures, including the egg retrievers, the embryo transfers. I also specialize in recurrent IVF failures, recurrent abortions, and nowadays, जैसे हम सुन रहे हैं for the low AMH and even for the egg freezing. Of course, along with this, I can't leave the male partner. So I also specialize in the male infertility part whenever any person has got any problems with the semen parameters. So yes, I'm Dr. Kalyani Srimali, welcoming you all to this podcast with Dr. Isha. Thank you, Dr. Isha, for having me here today. And hopefully, we both together will be able to bust a lot of myths which we have around IVF and what IVF exactly is.
Thank you so much, Dr. Kalyani, for joining us here. I'm sure this session will be really helpful for someone who is seeking support during their IVF journeys.
Correct.
So let's come to my first question. What are the most common reasons for IVF failure?
So when we speak about IVF, as we all know, IVF is an in vitro fertilization.
Right.
So all what we are trying to do is whatever is happening inside your body, the fertilization part of your egg and the sperm.
Yes.
When we do it outside our body, we call it as in vitro fertilization. So what happens in India is people feel that IVF is my last hope. कि अगर IVF से नहीं हुआ, then I'm not left with anything.
Right.
So we need to be realistic. IVF doesn't mean that it's going to be 100% success rate. I'm sure if you visit a good center, a good specialist, they will let you know that the maximum success rate what we can have with all the advances and technologies is approximately 60-65% what we tell the patients, depending upon the age.
Right, it varies by individual. Yes.
So when we speak about IVF failure, there are multiple reasons towards IVF failure. So the first and the foremost, what we say is the embryo in itself, because we are watching that embryo grow, what is happening to that embryo. So if your embryo, or let's say the day 3 fertilized embryo or the day 5 blastocyst, if it is not good, if it is not healthy, then probably your IVF may fail.
Right.
Now, what happens when I speak about if the embryo is not healthy? So one is there are technologies, the advanced ones, where we try to take this embryo to grow up to the blastocyst stage, which is known as the day 5 embryo.
Right.
So now we have seen this embryo under the microscope, how good the embryo is looking under the microscope. But I don't know if internally this embryo is good or not. So that is the genetic part of the embryo.
Yes.
So I always tell my patient, like, you're watching me, I'm looking healthy to you. But do you know if I have diabetes, if I have thyroid, if I give you my reports, you'll be able to tell me, right, that I have any problem or not. Same way, similarly, अगर आपका embryo is healthy from inside, it will lead to a healthy pregnancy.
Yes.
But if your embryo is not healthy from inside, may be healthy from outside, but it may, lead to the one of the cause for the failure of the IVF.
Right.
So one reason could be because of the embryo.
Yes.
The second is the uterus in itself. Uterus is the place where your embryo is going to go and stick. So it is like हम बोलते seed and soil theory. So first is your seed is your embryo. Even if I have a good looking seed, even if I get it from US or I get it from UK, but if the seed is not internally good, it will not grow.
Yes.
So that's what happens with the embryo. The second is the soil. Soil is where your seed is going to grow. So uterus is your soil. If your uterus is not good, if your layer or the lining, if your doctor is saying that, aapka endometrium is thin, it's not growing after a certain stage, probably that is one of the reasons.
Right.
Second could be something known as receptivity. We call it as endometrial receptivity. If the timing of the embryo is not correct going inside, probably that is one of the reasons that IVF may fail.
Right.
Third could be multiple reasons inside the uterus itself. Like, sometimes बहुत सारे fibroids हो सकते हैं करके. There can be polyp inside the uterus, or there can be adhesions inside because of the infection.
Yes.
So that can be the reasons behind your uterus not accepting the baby. And the most important nowadays what we are seeing in the last 1 year, what the research has come, is for the chronic infection in your endometrium lining or in your layer. which is
Right.
known as chronic endometritis. So
Hmm.
that can be diagnosed when we do the endometrial biopsy or when we do a hysteroscopy. So
Hmm.
yes, one of the reason could be that.
Yes.
Third could be immunology itself.
Hmm.
Now your baby is made half with your eggs and the half with your
Right.
husband's sperm.
Right.
So probably your body is not accepting it. It's
Hmm.
trying to reject this
Yes.
baby, which is known as the immunology. Body is trying to
Hmm.
fight this baby out.
Hmm.
And that could be one of the reasons that it may fail.
Right.
Fourth is the nutrition
Hmm.
going to the
Of
baby.
course.
In case if good blood supply is not going to the
Hmm.
baby, if in case there's no healthy endometrium that is getting formed, or if the nutritional deficiency is there,
Hmm.
could be one of the reasons that IVF may fail. So usually these are 4 or 5 parameters which we
Right.
look into when we have the IVF failed, and
Hmm.
depending upon the reason what your doctor is telling you that this may
Hmm.
be the reason, maybe your next cycle could be planned according to that.
Right.
And I think it's an important question, and I would like to address it here.
Hmm.
Please don't try to change your doctor, because
Hmm.
first IVF if you have done there and if it has failed, the doctor and the team out there knows your in and out of your
Right.
IVF cycle.
Yes.
Once you change the doctor, the other doctor
Hmm.
has to start the
From the
ABC.
scratch.
Yes.
Yes.
And then we miss again on so many
Hmm.
important things. So yes,
Yes.
we do have advanced technologies now which can
Hmm.
be used to understand what is going wrong with the IVF cycle and then address it accordingly.
Right. And what I feel is, being in optimal health and also getting the advanced test done before getting your IVF
Correct.
done is critical. That
Correct.
will ensure the success of the IVF.
Yeah, so coming to the same part, what happens is, Dr. Isha, now it's a Pandora box. If I
Hmm.
open it, there are so many tests.
Of course.
Anyways, here in India, we feel that, the IVF is on the expensive part.
Hmm.
In fact, we are the cheapest in the world.
Right.
If you go to US or UK, it will be
Hmm.
in thousands of dollars
Dollars.
and pounds. But still in India, we feel that, IVF is on the expensive part.
Hmm.
So if we keep on adding a lot of tests to the patient or the couple,
Hmm.
it becomes too much of financial burden on them.
Right.
But yes, we have to select the proper patient. Now, if I
Yes.
have a patient who has got recurrent abortions, like, उसको pregnant होने में कोई problem नहीं हो रही है, but she's not able to carry her baby
Right.
forward, we have to investigate them first,
Hmm.
like something known as karyotype, which looks into the genetic part or the
Yes.
chromosome part of the
Yes.
couple.
Hmm.
And if I found that there's a problem in, let's say the husband's karyotype,
Hmm.
I know I need to do an IVF for them,
Right.
but not to create the embryo or to give them the pregnancy. It is to check if this baby is healthy genetically or not
Hmm.
by the technology known as PGT. Yeah.
Hmm.
So that it can help, to have
Yes.
a healthy pregnancy.
Hmm.
So yes, case selection is very important for
Right.
us to understand what has to be given in the
Hmm.
technologies or in the treatment protocol for the
Hmm.
couple,
Hmm.
and then accordingly guide them.
Makes sense. Let's move on to the second question now. What are the chances of success with frozen embryo transfer in case someone has already had a failed cycle?
Okay. So again, a very good question,
Hmm.
Dr. Isha, because this is something which is getting very common
Hmm.
now. So when we started the IVF 15, 20 years back,
Right.
we were all used to doing was a fresh embryo transfer,
Hmm.
because we did not have the technology of freezing at that time.
Hmm.
What we were doing were the slow freezing technologies.
Hmm.
And that gave us, the survival of the embryo has only around 30-40%.
Okay.
So that was one of the reasons that we
Hmm.
preferred doing the fresh embryo.
Hmm.
But what happens when we do the fresh embryo transfer?
Hmm.
Your body is already under so much of stress
Right.
because of the hormones what we have given you,
Hmm.
or the injectables that we have
Yes.
given you. So it is more than the physiological level. So
Hmm.
let's say your estradiol level, the
Hmm.
estrogen hormone, which is very
Yes.
important for your egg and for your endometrium.
Right.
In a natural cycle, it's between 150 to 250
Hmm.
picograms. But when we are doing an IVF cycle, it may go beyond 1000,
Hmm.
1500. Sometime in PCOD patient, it may just go around 7000, 8000 picograms.
Okay.
So there are certain things which is in the body which is not normal according to
Right.
the nature. It's on the
Hmm.
higher side.
Yes.
And that is one of the reasons that your endometrium lining may not be so receptive to that embryo. And the success with fresh used to be just around 40-50%
Okay.
at that time.
Hmm.
And sometimes patient did have certain side effects as well in the polycystic ovarian patients,
Hmm.
something known as hyperstimulation
Yes.
syndrome. Yeah. So where
OHSS.
OHSS,
Hmm.
correct. So that means that she'll have certain fluid developing in the abdomen,
Right.
and then she have to get admitted and all those
Yes.
things. So that was one of the reasons that we were afraid with IVF in the initial days. But with the advent of a lot of technologies, something known as vitrification came in.
Okay.
And that is the basis towards your freezing of your embryo. So vitrification is like a quick freezing of the embryo. So from the room temperature, we in the next 10 to 20 seconds, we take them to minus 196 degrees.
Right.
So we are creating a formation of the ice level around the baby with a cryoprotectant so that the baby is protected inside. And when we thaw it, it is again in a faster way. So we got a survival of almost 99.9% with this vitrification technology.
Great.
So now with the frozen embryo transfer, what we are speaking about, जिन patient का पहले failure है, let's say they have done fresh transfer. So maybe one of the reason could be because of the stimulation. So it is preferred to do a frozen embryo in such cases so that we are trying to follow the nature. We are trying to keep the optimum level of the hormones, जैसे एक natural cycle में होता है, so that we get a better success rate. And that is the reason with the frozen we get a better success rate of almost 60 to 65%.
Okay.
Depending upon each and every parameter that we have taken into account. So yes, now the world is shifting towards the frozen embryo transfers. And we are trying to do a natural frozen embryo transfer rather than giving them the tablets to create the endometrium now.
Okay,
so we are seeing we are seeing a lot of benefits when we are doing the frozen embryo transfer, and it also gives the patient to relax, take rest, take their own sweet time to come back to the normal, and then come back physically and emotionally more stronger to take the transfer of that embryo.
Right.
The other is we talked about PGT. So when we are doing some process like PGT where we are testing the embryo, we have to wait for that report to come in. So that's again one of the indication for doing the frozen embryo transfer.
Okay.
And third is of course the PCOD patients, wherein we don't want the patient to have any side effect because of the IVF.
Right.
We want to make this IVF has safe as much as possible for the patient.
Okay.
And that is one of the indications where we are going for frozen. And now the most important and the most upcoming reason for doing the frozen embryo transfer is something known as cryopooling.
Okay.
That means, let's say a patient has got only 3-4 follicles. Her AMH is very down, 0.3 or 0.4. And a lot of doctors have advised her that it's better कि आप donor कर लो, because you don't have sufficient eggs, so you should take donor. So now the concept of cryopooling has come, where we combine 2 or 3 IVF cycles. We pull the embryo from every IVF cycle.
Okay.
We collect them, and then later on we start doing the embryo transfer for them.
Okay.
So that way we are able to give the patient or the couple their own genetic child instead of shifting towards the donor.
Yes, makes sense. This is very, I think, helpful technology now, especially for patients who have low AMH.
And the other is with the advent of, a lot of technologies and accessibilities. Now we have good embryologists who have come in. We have got good technologies, good machines, good medias, which is helping to improve the success each and every passing day. We are able to improve the success rates now.
Right. So it's very important for the patients to choose a a center which is fully equipped with right technology and advanced technology.
Yes, like पहले जब IVF centers होते थे, we did not have so many of embryologists, and still there are a lot of embryologists who do freelancing. 2 घंटे ये center में, 2 घंटे ये center में, which is not correct.
Yes.
Because the timing for the gametes is very important. Like small thing, आज अगर मैंने 11 बजे eggs निकाले हैं, after 4 hours I'm supposed to do the IVF for the ICSI.
Okay.
So if my embryologist is not available, we are wasting on that time.
Yes.
And post the ICSI, after certain hours we are supposed to check the fertilizer. So this way we are keeping a track of your embryos, how they are dividing, how they are growing.
Right.
So if I don't have a full-time embryologist doing that, or a full-time embryologist maintaining my lab quality, it will affect your success. So yes, selecting a center is very important. I think finance should be the later part, but selecting a good clinical team and a doctor and a center is the most important crux of having a healthy and a successful IVF cycle.
Of course. Now let's move to the third question. Now, what are the options for someone who doesn't have any remaining frozen embryos? Any additional test, like you previously also mentioned, to make sure that the next IVF cycle is successful?
Right. So, like I said, if your first IVF fails or you don't have any more embryos left, do not try to switch the doctor, because the doctor will have each and every information. We will be able to share the information with you, but small things what we have observed during your cycle, we can't share our experience with the other doctor that where you are trying to shift. So that is one of the reasons that you should try to stick to your original doctor. Unless you are not satisfied, that's a different story. But if the lab is good, the clinic is good, the doctor is good, the success rate overall in the clinic is good with all the facilities, you should try to be with the same doctor, so that we can go back to your previous cycles, to your history, we can sit together, we can discuss, that, okay, I saw 10 follicles when we were doing the stimulation. We retrieved around 8 oocytes, but out of this 8 oocyte, I was able to see only 4 good, healthy oocyte for you. Post the IVF or the ICSI, on day 3, we had the status, day 5, we had. So we try to identify the reasons why, the embryo growth did not happen, whether egg is responsible, whether sperm is responsible, or whether both the egg and the sperm both are responsible. And accordingly, we guide our patients. So in case if we know 42-year-old, we are not seeing good number of eggs, probably we may discuss the option for the donor eggs for them, or what I suggested for the cryopooling. But we may combine the technology of genetic screening of the embryo. Maybe it's an abnormal embryo which did not stick.
Right.
The second could be if there is a problem in the semen parameters, we'll look into that. There are a lot of tests now which are available, something known as sperm DNA fragmentations, something known as the HbA binding. So we can do all those tests to find out if there is any problem in the semen parameters and accordingly guide the patients.
Okay.
Nowadays, we have a lot of sperm selection methods, also technologies like microfluidics.
Okay.
It is something where we are not centrifuging the sperms and trying to decrease the DNA fragmentation of the semen sample which is there, and try to get the healthiest of the sperm and do the IVF or the ICSI. For the eggs, again, we do check on the quality, and if we feel it is not up to the mark, give them the option of cryopooling or give them the option for the donor.
Okay.
If they were healthy embryos, like let's say I have already tested the embryo, they were genetically normal, but still the uterus did not pick it up. Yeah, there's something known as ERA, endometrial receptivity assay, or something known as a hysteroscopy, wherein we put our camera and look into the inside of the uterine cavity to see if there was any infection or any other problem, and then plan the next cycle with them. If the patient age is not a concern, if they are healthy couple, age less than 40, I would still recommend them to undergo IVF with their own gametes again, and to see what we can do to improve the quality or the number of embryos that is getting formed. But of course, if they already have 3 or 4 cycle fails, the age is around 45, we know probably will not get good embryos out of it, and one of the reason would be the genetic problem. We would switch to the donor side.
Okay. And one question that is striking my mind, you also talked about immune response, that body has its own. Is there something we can do to manage that response?
Yes, so nowadays we do have certain technologies, or let's say therapies, which have come in. One is something known as the lymphocyte immunotherapy that we are doing commonly, wherein we are trying to match the HLA of the husband and the wife both together, because probably the baby is getting rejected because of not identifying that HLA. So probably we can do that. There are certain tests which are now available. We do a panel known as ANA, anti-nuclear antibody. There are HLA matching which are done. There are natural killer cells, but this are all a little expensive tests. But yes, they are available now in India that can be done.
Okay, amazing. Okay. Now, another important question. Are there any specific supplements or vitamins that you would recommend to a woman who is undergoing IVF?
So, Dr. Isha, see, supplements is something I would recommend it to anyone who is planning for a pregnancy. It's not just for an IVF case. I think anyone who is preparing the body to plan a baby or welcoming the baby should be doing certain lifestyle modifications. And I'm sure no one better than you will be able to explain it to your family out there on Instagram. That yes, preparing your body is one of the most important things.
Right.
So I guess the first starts with the lifestyle modification for both. It's not just the wife, it is for the both, for the husband and wife. So for example, if you're overweight, you should try to reduce on your weight. If you're not exercising at all, it's just a desk job that you're doing, probably you should get up. We always tell our patients to at least do any type of exercise for 45 minutes to 1 hour.
Right.
It can be anything. It can be just walking, it could be dancing, it could be just climbing your stairs, it could be yoga, whatever feels good to you. When we speak about exercise, it doesn't mean that you need to do the gymming.
Right.
It can be anything. The third is having the healthy food. Dr. Isha will, I think, must have covered all the healthy food. And of course, when we speak about the supplements, there are certain supplements which we do try to give to our patients. One of them is something known as antioxidants. So now there are a lot of antioxidants which are available in the market. But the most important, what I feel, is like something known as vitamin E, vitamin C, CoQ enzyme, CoQ10. These are the things that you need to take
Right.
And especially in women who have got poor quality eggs or lesser, less AMH, there's some supplements known as DHEA that we would prefer giving for 2 to 3 months.
But that's only on doctor recommendation.
Only on doctor
Otherwise,
recommendation, yes.
yeah.
Even I feel antioxidants should be on the doctor recommendation, because there are a lot of herbal preparations, there are a lot of preparations which are over the counter preparations, and we don't know, sometimes they may not be of such good quality. So there are certain things that we need to look into it.
Yes.
Like in the PCOD patient, we do prefer giving myoinositols and all those. So speaking to your doctor would be very beneficial to understand what supplements you can take.
Right.
Similarly, for the male part, if your sperm count is on the lower count, there are medications which are available which may help. Not 100% necessary that the count will increase, but it may help.
Yes.
And
especially if the reason is any nutritional deficiencies.
Yes, and what I tell the couple is, whatever supplement I give, it is not that it's going to 100% work towards it, right? But it is not giving you any side effect.
Yes.
Even if it helps you by 10% in correction of your DNA formation, or putting in that energy back into your egg or your sperm, rejuvenation, what we call as, it is worth it. So that is the reason we ask them to, switch over to certain supplements. The other is, most of us are vegetarian out here, so we do miss on certain good supplement, the natural, the natural sources of the food. And probably that is the reason we prefer giving the antioxidants out in India more than what people out there in the Western countries do.
Makes sense. Now let's move to the second last question. Can we also speak about certain alternate fertility treatments or options that you would recommend for someone who has experienced recurring IVF failures?
Okay, so I think by the end of the discussion now, we would have understood what are the reasons behind the failed IVF and all. So yes, so if I speak about the embryo, what we can do is, if you have not tried the genetic therapies for the diagnostic technologies for your babies, probably you could check with your doctor if you should be doing the PGT or the pre-genetic implantation for your embryos, to understand if the embryos are euploid. That means if they are genetically normal or not.
Right.
If not, you may check with your doctor if there was any problem with the egg or the sperm. If there was, consider going for donor egg or donor sperm. If there was some issue in your endometrium lining, like we talked about, sometimes there could be thin endometrium, because tuberculosis in India is very common. So sometimes, especially in the north side, we see a lot of patients having thin endometrium because of the tuberculosis. So now there are certain therapies which have come in, something known as PRP, platelet-rich plasma, that we can insert in the endometrium, which may help. So it's not a 100% proven thing, but it may help in certain patients to, just to put in those growth factors to have that endometrium grow. We do have other technologies also which the patients can go, something known as natural IVF cycles, or mild IVF cycles, which may benefit the patient by having much more better quality of the embryos. So when we speak about the cryopulling, like let's say a patient 38-year-old has only 1 or 2 follicles, probably no need of giving them the injectable hormones. We can just put them on the medication, see a natural cycle, how the follicle is growing, and aspirate and see if it's a good healthy egg, and do the IVF for it. So yes, there are now therapies for natural IVF, and something which we called as mild stimulation or minimal IVF cycles that we do.
Okay.
We can combine in the alternate therapies or the additions of yoga, acupuncture. This is something which is the holistic approach towards the IVF. It's quite something which is going on in the Western world. It is yet not seen in India so commonly. But yes, in the Western world, people have started combining the use of the acupressure punctures and the yoga for it.
Of course. One question that was striking my mind is, how long should someone wait before, if they have had recurring IVF failures and now they also want to go for another IVF cycle, how long should be that waiting period?
So, technically speaking, there is no problem. We can do a back-to-back cycle. But we always believe if there's a 1 month of gap, because that helps the patient to come out emotionally from the trauma what she has faced, so that she is mentally more strong. Of course, in that 1 month, we will also be able to figure out what went wrong, so that it gives the doctor and the team also a little bit of time to understand what better we can do for the patient. But certain times we are in the constraint of time, like a patient who is visiting from outside India, they don't have so much of time. So then for those patients, we do sometimes combine something known as dual stimulation also. Like let's say she has less number of eggs, so she doesn't have time for 3 months to do the cryopulling. So we'll try to optimize that 1 month for her. In the first 10 days, we'll stimulate her, collect those eggs. Again, in the latter half, we'll start stimulating her after 3 or 5 days, collect those eggs again, create those embryos and pull for her, so that, in that one cycle, she's able to do at least 2 IVF cycles and pull her embryos.
That's interesting.
Yeah, so that's known as dual stimulation. So there are many other things that we can do for them. But yeah, theoretically speaking, there is no indication that we need to wait for the second IVF cycle, unless on the sonography or the ultrasonography, your doctor feels that, this is not the correct month. We are seeing some ovarian cyst. We are not saying that, you have not bled properly, your hormones are unstable.
Right.
In those cases, probably we'll wait and watch that, you take a month's break and then come back again.
Okay, great. Now coming to the last question, any suggestions for a modern couple who wants to delay their pregnancy?
Okay, so when we so 2 parts. It's a topic of my passion that you have brought up. So when we speaking about delaying the marriage, so let's say we have a couple who are in their 35 or 36, just got married, but don't want to plan the pregnancy right now. That we are still young, we want to settle down our career and everything. Probably in those cases, we'll still recommend them that do your IVF, freeze your embryos and keep, so that even after 3 or 4 years you want to come back, we will be able to give you that embryo back into the uterus. For the girls who are not ready to get married and she does not have a partner currently, we are telling everyone to start freezing their eggs, because the biological clock is the truth. You can't change your biological clock, even if you're 35. But if your eggs are behaving like something like 40, you can't change that. So before you reach that biological clock, it is better that you freeze your eggs at a correct time, so that even if you want to plan your pregnancy at a later stage, there should not be any issue. You can just use those eggs and have your own genetically healthy child. So I think that's a wonderful technology which has come up, and it is advanced so much that it is actually truly the sense of women empowerment. Just the baby part or the pregnancy part will not be stopping you from getting into your career or getting settled in your career, going for your studies outside, for your job outside. It should not be the stopping factor from your family that अभी तो शादी नहीं हुई है, तो यूएस जाके क्या करेगी या तो यूके जाके क्या करेगी करके. So now you know that you have this facility where you can freeze your eggs and keep. You can completely settle down and then come back if you need. So what we tell the young girls is, it is something like your insurance. So every people nowadays, हर कोई आजकल insurance ले रहा है. It can be term insurance, it could be health insurance. We are still taking term insurance. Lena doesn't mean that I'm going to die tomorrow, but we are taking it for our family, that something happens to me, the money could be given back to them. If something happens to me, if I have to get admitted, I should be able to pay my bills. So I am taking a health insurance. Same way, egg freezing or oocyte freezing is your insurance for your future. Maybe you need it and maybe you don't need it, but it is something that you can keep it for yourself. You know that you have frozen it, and then maybe even after 10 years you can use it. And it is so common, and I'm so glad that so many celebrities have come out with this thing, especially Priyanka Chopra and all, who have at the correct time, they were busy in their life, they did not know where the life was going to take them, and they were able to freeze their eggs because someone must have guided her, or some doctor must have guided her that it's the correct time for you to do. So I think both of us should also be able to guide our Insta fam and the social media people that it is your correct time. You should at least go and visit your specialist, understand what the process is, and if you're convinced for it, you should go ahead and do the egg freezing.
Of course. I'm also going to encourage all the women who are connecting with me. Even if they are delaying their pregnancy, they have their own plans, then definitely they can go for. One question last, that is egg freezing better or embryo freezing if they already have the partner?
So if they have the partner, embryo freezing is always better, because the survival of the embryo is much better than what the egg is. Egg freezing is a relatively newer technology, but still we do have very good success rate with the egg freezing also. When we take the eggs, there's almost 80 to 90% survival, which is very good. So we say that at least we should have around 10 good eggs that we have frozen. So sometimes we do 2 cycles for them to have at least that much in the pool. So that is the reason doing the egg freezing at the correct age, especially if you're less than 35, is the best time to freeze your eggs, because the eggs are going to be healthy and better in number. But currently, even if we have a 40-year-old who wants to come and do,
Hmm.
because at unke time pe nahi tha wo, now it is
Hmm.
available. So
Hmm.
that is also not a late age. But yes, if you do it less than 35 or less than 30, that is the correct age for you to go ahead.
Hmm.
So if you
Hmm.
don't have a partner, egg freezing is the best. If you
Okay.
have a partner, then the
Hmm.
embryo freezing.
Great, great. So this was really insightful. It was honor having you here with this in this discussion with us. So thank you. I want to thank Dr. Kalyani for taking out time for this session, and I am going to add her contact details in the description below, so you can reach out to her if you are residing in Indore or nearby areas. I will also add details of my Instagram account and the channel details where you can join me and learn more tips and techniques to conceive. And that was all. Thank you so much. I hope all your queries were answered regarding IVF and IVF failures. Thank you.